So today we will look at how we can open up perfect circles when we have a compressed or oval shape and we really want to get that circle nice and true. So again, we're using my phantom here and I'm going to come in. Now it doesn't matter if you're doing this in an AP fashion or a lateral position. If you're in the lateral, then you just replace tilt with wag as I described them. So I'm going to come in to where I feel is centered. So let's go ahead, take a picture there. So here's our first image. So what I want to do here is I'm going to slide south ever so slightly, and then I'm going to push in a little bit. Now, I expect the circle to be closer to the center. So now that I'm hopefully locked in there, I will mag up, and I'm using mag 2 for this. So let's take an image there. So you can see here that the circle is almost in the center. I will pull back ever so slightly, and I also have to move the circle ever so slightly up. So again, microscopic movements that you probably can't really tell too much. So as I'm keying it into the center, I will take another picture. So now we're just ever so slightly south. We'll try there, an image. So now that I'm here, the circle is in the center of the screen, but it's not perfect. You can see there is a double shadow. So in this instance, I'm looking at the direction that the shadow was in, and it's a little bit at 45 degrees. So that tells me that I need a little bit of tilt and probably a little bit of roll. So let me go ahead and roll in one plane, and these are small adjustments. Maybe just half a degree. So let's take an image there. That has improved it, but you can see it has moved off center. So I need to keep that in the center because the surgeon is basing their drill path off of that central ray alignment. So my image has to be in the center. Again, it just jumped a little bit. So picture there. And there we go. Now, I can see on the left, or on the bottom edge of the screen, which is the left-hand side of where I'm standing, the foot end of the patient, I have a little bit of a double shadow there. So that tells me I have a hair of tilt. Let's see what happens there. That made it worse. So I take that tilt off and then apply it a little bit more the other way. And here, I'll take a picture without motion. Now we can see that we have demonstrated that perfect circle nice and open and at its fullest.